residents in Ghana who are not fully vaccinated would, however, need to provide a negative PCR test result of not more than 48 hours. They will undergo an antigen test upon arrival at KIA and will be offered vaccination there. Ghana's foreign mission have been instructed to make vaccination a requirement for visa acquisition, that the establishment of the COVID-19 testing infrastructure at the Kotoka International Airport by Frontier Healthcare Services Limited at its own cost has been key to our ability to limit successfully the importation of the virus into Ghana through the airport. The efficacy of the testing regime at KIA has won global admiration and has been applauded by all those who have undergone its testing. It has been one of the reasons why Ghana was not at the receiving end of several of the travel bans imposed by the West at the height of the pandemic, for which many African countries were affected. As from tomorrow, Monday, the 28th March, all land and sea borders will be opened. Fully vaccinated travelers will be allowed entry through the land and sea borders without a negative PCR test result from the country of origin. Citizens and foreign residents in Ghana who are not fully vaccinated will have to produce a negative 48-hour PCR test result and will be offered vaccination on arrival. From tomorrow, Monday, 28th March, the wearing of face masks is no longer mandatory. I encourage all of you, though, to continue to maintain enhanced hand hygiene practices and avoid overcrowded gathering. All in-person activities, such as those that take place in churches, mosques, conferences, workshops, private parties and events, cinemas and theaters, may resume at full capacity as long as the audience and all participants are fully vaccinated. Hand washing and hand sanitizing points should be made available at these venues. Outdoor functions at sporting events, entertainment spots, political rallies and funerals may resume at full capacity, again, as long as all persons at those events are fully vaccinated.
So those are the headlines, really, from what the president shared yesterday. Let's figure out the implications. We have two of our favorite voices on COVID issues. Dr. John Amoisi from KNUST, let me tell you specifically. He is a lecturer at the Global Health Department at the School of Public Health, KNUST. He's also the leader of the Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research in Tropical Medicine, KCCR to you and I. And of course, Dr. Kwame Sapong-Asiedu is a pharmacist. He's a fellow of the Ghana Center for Democratic Development, CDD Ghana. Gentlemen, good morning to you both. Great to have you.
Good morning. Good morning to everyone.
Well, good morning. So I'll start this way. We have a low vaccination rate. So my question is this a safe decision? Probably would start with you, Dr. Amoisi.
No, thanks for that, and good morning to everyone. It's a pleasure to be back on air and to talk about COVID issues. I'm sure this will be one of the last, hopefully. No, but I think it was really welcome news that we heard yesterday. But just to take a quick step back, it's gratifying to see the way COVID has progressed or evolved in Africa by way of the epidemiology. It has changed a lot with regard to the way we live, but also made significant changes to the way we do science and engage with science across the continent. The changes have been seismic, to say the least. We started off with very interesting predictions about this disease, and a number of us did think that on our continent, we're likely to have things milder because of a couple of things. Although we did caution, that we'd be very careful and do the right things to make sure that the gains were safeguarded. One thing I find very interesting now, and I can tell you, it's making the rounds in scientific articles and in discussions in science, is why Africa did not have it as bad as the rest of the world. And I really would that the media discuss this extensively. The reason is, interestingly, many people in the West are now suggesting that Africa actually had it equally as bad as the rest of the world, but was only due to underreporting. I strongly reject this notion. It's totally unscientific. And actually, the scientific evidence does not show that underreporting is the culprit here. Of course, underreporting is a big issue, not only in Ghana, but in the entire world and other parts of the world, even in the West. If you look at it carefully, you look at the figures for Ghana, countries like Ghana, countries like Nigeria. Compare that to Burkina Faso, Togo, Ivory Coast, and others that had relatively poorer record keeping and testing. And you get the impression that Ghana was harder than these countries, but it's not really so. So yes, underreporting is an issue, but let me just state it very clearly. The scientific evidence is that COVID did not hit Africa.
Hello, Dr. Amoisi. We seem to have lost him
Very
there.
compared to the rest of the world. Okay. But now to the substantive issue about the restrictions, I think that it is long overdue. It's a step in the right direction. If you look at the evidence on the ground with the work that we've done on seroprevalence, it tells you that the disease spread equally as fast as it did in other parts of the world. In many places, we're having about 60% of people having antibodies to SARS-CoV-2, which means that they had been exposed to the disease, and yet these were places where people were hardly vaccinated at all. So if you juxtapose the high seroprevalence on the vaccination that we've done, hovering around 20+%, one would say we're not in a bad place, but there is a caution here. I must sound this very clearly. And it's two things. It's depending on two things that are variable. One is immunity wanes. So whether you got it naturally or you got it via vaccination, it will go down. The second variable here is that.
Okay, so we seem to be having some connection issues with Dr. Amoisi.
It's really important that we kind of be ready and be in a place where if something should go wrong, we can quickly adjust. Things are looking really.
Okay, apologies there. We'll try and raise Dr. Amoisi, but we've got Dr. Kwame Sarpong also joining us. Good morning again. So let me just first of all get your quick reaction to the reversal of the COVID restrictions.
Good morning, Mama V, and good morning to all of you. Yes, to be fair, it had become untenable for those restrictions to be in place for a number of reasons. The first thing is, when you have any new disease, there's one thing that has to be established. What is the correlation between the number of people who get infected, the number of people who get hospitalized, the number of people who get severely ill, and the number of people who unfortunately die? At the start of COVID, there was a positive correlation. So when that happens, that's why you go from an outbreak to, an epidemic, and then to a pandemic. Once you go to pandemic status, then draconian measures had to be brought in place to try and slow down the virus, because if you got infected, there was a high probability you could die. As time went on, this probability kept dropping. And it has been dropping significantly as vaccination status has changed. That's the number of people who've been vaccinated in each population has changed. So you'd realize that in a number of countries like the UK and Israel and other things, they've rolled back significantly because their, community immunity is high. It's around 70+%, which is towards the herd immunity threshold. Listening to Dr. John Amoisi, you clearly realize that we have a backbone immunity of about 50% because of our seroprevalence, which said that a number of people had been exposed, even though they hadn't been factored into our true cases. If you put that all together, then you have to juxtapose that against the economic question, that what are the advantages of keeping the economy shut when, in actual fact, that linkage between infection and death has been broken? And I keep using the analogy. There is a linkage between malaria infection and getting sick, but the linkage to death has significantly been broken because there are treatments and now there are vaccinations. So nobody will shut a country down because there's the risk of people getting malaria. Similar with flu, similar with other diseases like typhoid fever, you name it, and even meningitis, even though there can be an outbreak. So what would be the justification now to make such a decision when it comes to COVID, when a similar point has been reached in the trajectory of the pandemic? So I wasn't really surprised at the decision, and I think it's welcoming news.
Let me ask this, and I think we've been rejoined by Dr. John Amoisi. He's now joining us via phone. So I'll start with you, Dr. Amoisi. So the borders are now open. We do know that throughout this pandemic, the surges that we had in Ghana were through cases that came in from abroad. We also know that the land borders are now open, and at no point during this pandemic have we had those land borders open. So we have never had any controls at those borders, nothing like what we have at Kotoka, which has now been relaxed. Now, vaccinated people can still infect and be infected. And we're saying that vaccinated people can come in without any test at the airport. Also, nightclubs and all these places that we said could not open are now open. They can now open. Masks are no longer mandatory. In light of all these, can we expect a rise in numbers in the coming months?
It's a very potent analysis. I'm sorry I got off Zoom, but I think it should be good now.
Yes, we can hear you clearly now.
Oh, great! I hear an echo, but I'll just go on nonetheless. So I think it's perfect in order to have the land borders opened. If you ask my very candid opinion, I would say it's long overdue. But at the same time, it's better to be safe than sorry. And now we definitely know that we're pretty safe doing this. If you look at the seroprevalence estimate for countries that are neighboring to us, at least we did some work with Burkina Faso, and their seroprevalence estimates were no different from what we have. So it tells you that the risk is no greater in Burkina Faso, in Togo, or in the Cote d'Ivoire than it is in Ghana. It only makes perfect sense, and across the West African sub-region for that matter. So I don't see any added risk by the opening of the land borders at all. Now, with regard to the nightclubs and churches and mosques and all these places, I think Kwame made a really important point, and he hit it that point with linkage to death. There is a difference between getting infected, being hospitalized, and dying. These are three very separate estimates with COVID. And what we saw in Africa is that the infection rates were no different than what we saw in other parts of the world. The hospitalization rate is a bit patchy because of our hospitalization policy and our record keeping. So it's really difficult to tell. But if you look on the face of it, definitely our hospitalization rates were not significantly comparable in any way to what happened in the West. And it was only at 1 or 2 points, I remember, that we got close to breaking capacity for COVID admissions in the hospital. And definitely, by any measure, our death rate, although we did have quite some mortalities, nothing compared to what happened in the West. So that being said, even if there is a risk of infections going up, and make no mistake, there are some infections going on, we still have some cases. It's not such a big deal with regard to the risk for hospitalization and risk for death. What I was going on to say before the Zoom cut was that the issue of a public health paradox is what comes in here, which is putting sentries on the wall to be on the lookout in case something goes bad. Because we know that this virus can mutate in one direction or the other. We don't know. It's unlikely at this stage that it's going to morph into something really bad, but not impossible. So for this reason, you want to be ready. And this is where the science comes in and putting in place these measures, randomly testing people who are coming in to go to class, even if they're vaccinated. Just like you do random selection of people for extra security, we should be able to do this. Random testing of people at our OPDs, random testing in markets and schools, just a little percentage, just so that if something is going wrong, you can catch it early and take action. But let me reemphasize right now at the stage that good things are: good decision, open borders; good decision, open up everything, no mask wearing, but put the sentries on the wall. So if anything bad could happen, we can pick it up.
Okay, let's Kwame, let's talk about the science behind this. You've really sort of set the stage by explaining, especially using examples of other pandemics and other outbreaks, to explain where we are in the cycle of the COVID pandemic and why easing of restrictions makes sense at this point. But as I was asking Dr. Amoisi, mathematically, can we expect a spike in infections if even we can be comfortable about hospitalizations and death? Can we expect an increase in infections following the easing of these restrictions?
Yes, I mean, and that is why I keep saying that we are in the phase of self-preservation, like happens with every disease. And you want me to use the data. So as it stands now in the UK, there's an escalation in the number of infections, even though testing has now stopped, because the link has been broken with hospitalization. I mean, at a point when we're having 100,000 people test positive a day, there was no change in the hospitalization or mortality patterns. So, yes, if you open up, if people are not wearing masks, if people are not social distancing, because this is a virus that spreads through droplets and through aerosolization, there's a probability that, yes, people will get infected through different ways. People will touch doorknobs, they will not be washing their hands. And that is why the president saying that you have to exercise caution is important. You know your status. You know you're vaccinated. You know you've had a jab. That doesn't mean be reckless, because you can get infected. I mean, recently I saw a letter come out of University of Ghana saying that there's an outbreak there of an infectious disease, and they've had a number of cases. Should the university be shut down? No. They write public health alerts like that to ensure that people can be on their guard. And it happens daily. I read public health alerts daily. It's part of my day job. You'd see, even to this day, you see alerts for bubonic plague that they would say, oh, there's been an outbreak of bubonic plague. So you see this. In the 14th century, if that happened, Black Death, the whole world got shut down. Today, you don't do that. And that is where we are at this point in the pandemic. Then to look at the other thing around people who are vaccinated, if you look at the data, you'd realize that when people are vaccinated, their viral load doesn't last as long. And so the time between them testing positive and negative is something like 5 days. So in the latter stage of this pandemic, you realize that UK even cut isolation to 5 days, because a lot of them who were double and triply vaccinated were testing positive and testing negative after 2 to 3 days. And it made sense because their bodies had been trained to identify their virus, and their immune system was able to overpower the virus pretty quickly. If what Dr. Amoisi is saying, and I have strong belief in the data they put out, is that our seroprevalence levels is 50% and we have 20% vaccinated, that puts us at 70%. Then we are playing with a similar ballpark figure. So then if you look at it from that biostatistic, biomedical standpoint, then there's no reason, if Burkina Faso has similar numbers, albeit their vaccination numbers are lower, to close the border between us and them. Neither is it, because you have to look at the livelihoods of the people living in those border towns. And at this point in time, the socio-economic advantages outweigh the public health risks. And when you have one tipping against the other, just as at the beginning of the pandemic, when the public health risk tipped against the socio-economic risk, some of us went for a lockdown, some of us went for these draconian measures. Now the scale has changed. And so we're going the other way. And it is how science operates. And for me, that's very comfortable.
Right. Now, let's look at the future. Dr. Amwesi, the president didn't say much about our vaccination drive. Would you expect that while all this is happening, that we should also be paying attention to that, bearing in mind that that is really how you benefit from these eased restrictions, especially when it comes to entering and exiting the country through our airports? It is when you are vaccinated that you benefit from it. Also, even the easing of the mask wearing restriction, you're better off with a vaccine in you. So, would you have expected the president to say something about our vaccination drive?
No, thanks for that, Kavil. I think the president made clear mention of vaccination as being your passport to getting into the country, and also your passport to engage in public activities. My challenge really has to do with how we're going to enforce this and make sure that people really have this vaccination done. It will be absolutely critical that we keep on hammering on the vaccination, making sure people have it, encouraging people to do it, getting people to set the example by vaccinating, because it really is the key not only to getting the best benefit out of this, but also to prevent anything from possibly going wrong. With the vaccination rate we have now, 20% plus, zero prevalence, 50% plus in some parts of the country, like Accra, Kumasi, and Tamale, it's I think 60%. We're in a good place right now. But I must emphasize that immunity, either obtained naturally via infection or via vaccination, will wane. And what this means is that if immunity wanes, and for any reason the virus takes a turn in another direction, it could be problematic. So for this reason, the smart thing to do is to keep pushing the vaccination activity, and also putting in place a system which allows us to check to the best of our abilities to make sure that people are vaccinated. The paradox, and I keep mentioning this with public health and all these measures for prevention, is that if things are going well, then there's no news. But when things are going bad, that's when there is some news. So it's like we need to keep on doing something to make sure that nothing happens. But when nothing is happening, people begin to question why you're doing something, because nothing is happening. And this is where the science comes in. So really pushing the vaccination is definitely the way to go.
So just a final one from me, and maybe Dr. Saponesied, you can take this one. So I am fully vaccinated. I wear the mask. In fact, I'm wearing the mask right now, but I was contemplating earlier if I should or should not. Can you advise me and the many people like me who are contemplating, should we continue wearing the mask since it's not necessarily mandatory?
Yes, thanks. There are three things I'll say. If you're someone who travels globally, and most of us do, you realize that long before COVID, any transit airport you walk through, be it Heathrow, be it Amsterdam, be it Munich, be it Brussels, you would normally see Southeast Asians in their face mask and nose mask or shields, and sometimes even them wearing suits. We found it as funny. If you look at the data, Hong Kong had one, even though it has one of the biggest exposures to China, it had one of the lowest mortalities. Same to Taiwan, same to South Korea. Why? Because they have a culture of wearing nose masks and being very evasive when it comes to diseases like this. So that's the first thing why you should wear the mask. The second thing is, if you look at the data from North Europe, you realize that since 2020, there hasn't been a serious outbreak of flu, and excess deaths due to flu has dropped significantly. Why? Because everyone is wearing a nose mask, and the people who are more likely to die if they had the flu virus infect them are not dying, not because of the vaccinations, because vaccinations for flu have been ongoing for almost a century now. The only change that happened was the use of the mask and social distancing and hand washing, and that led to a drop in mortality for flu. It also has a similar trend with other respiratory viruses and even pneumonia and other things like that. So if you have this one thing, which is a nose mask, which can protect you against the cough, the cold, the flu, and COVID, and even other things like meningitis, because they are all airborne, I struggle to see why you take it off simply because a president said you can't take it off. So that is the sort of advice I'll give to you. And that is why sometimes I want to be broad-based in my analogy so people can realize that it's not just because of COVID you have to do something, but you're doing it because it's in your best interest.
Right.
Listen, we want to thank you both very much. It's been a short but very insightful conversation with Dr. Kwame Sarpong-Asiedu from London and Dr. John Amoisi from Kumasi. We appreciate you both. And Dr. Amoisi thinks this will be one of the last. I doubt it. Thank you both.
We shall see.
Let's hope it is.
Well, hopefully the figures don't change after Easter.
We live to see.
Indeed.
Indeed.
All right. Thank you both.
Thank you.
Right then, it's the Super Morning Show. And have you ever wondered why you're not allowed to whistle at night? According to Raymond, you're also not allowed to sing in the shower, something which most people enjoy, as far as I'm aware, Mama V. And also, why can't you hand something to somebody with your left hand?
Sweep at night.
Yeah.
You can't sweep
Yes,
at
you can't
night.
sweep at night either. Lots of things you can't
Uncle
do. At
Ebo
night.
says, depending on the face of a person, you shouldn't let them sneeze on you in the morning.
Oh, wow.
Yeah.
I kind of tend to not let anybody sneeze on me in the morning, afternoon, or evening, regardless of their face. I mean,
Even in COVID.
I mean, I've got to tell you, it doesn't matter how pretty you are not sneezing on me at any time of the day. Doesn't matter where the clock hand is.
I am coming.
You and who? Anyway.
Sometimes
so-
it comes unannounced.
So that one is a personal taboo. But Nana Ansah Kwao joins us. It's been a long time since we had him on the show. He joins us to help us understand some of these things and even more after these.
Since inception, almost 100% of Ashesi University students have found jobs, started businesses, or gone on to graduate school within 6 months of graduation. From Accra to